Well, from the Penn Institute for Urban Research and the Volcker Alliance, this is Special Briefing. I'm Bill Glasgall in Adamsville, Rhode Island, and I'm here with my co-host, Penn IUR co-director Susan Wachter, live from the National Association of Home Builders meetings in Washington. Hi, Susan.
Hello, Bill. A lot going on now.
No kidding. We got a heck of a show for you today. Since Donald Trump was sworn in for his second term as president in January, America's states, counties, and cities and school boards have found themselves at the receiving end of the administration's new concept of federalism. You might even call it the big squeeze. It's an attempt to shift fiscal power back to the states, whether they like it or not. On top of program cuts and spending freezes and a trade war, by the way, President Trump recently proposed $163 billion in domestic program cuts in his new budget. And this is coming just as many states are trying to close budget gaps as federal pandemic aid nears its scheduled end. But how will states balance their budgets if they don't really know what will happen to Medicaid, to education grants, and more coming from the federal government? So which state programs may have to be curtailed? Which recent state tax cuts might be reversed or not? What will happen with the limit on state and local tax deductions in the 2017 tax bill that's up for renewal? And of course, will muni bonds lose their federal tax exemption? These are big questions, and to answer them and more, we've assembled some of the best minds in public finance to help you, our loyal viewers and listeners, craft strategies for the new federalism. We'll kick off the discussion in just a moment, but first this word. Special briefings are made possible by funding from the Travelers Institute, the Volcker Alliance, and members of the Penn IUR Advisory Board. As always, we're coming to you live on the Penn IUR and Volcker Alliance websites and also on this special briefing podcast. And as usual, we've taken your questions in advance and we'll address them later in the program. And now let's focus on the big squeeze and how state and local leaders are coping with it and what the opportunities are. From the National Association of State Budget Officers, please welcome Executive Director Shelby Kearns. From the National Association of Counties, we'll hear from Chief Economist Taryn Zamuda. After Taryn comes Emily Brock, Director of the Government Finance Officers Association's very busy Federal Liaison Office. From the State House in Providence, not far from where I am today, we'll hear from Jonathan Womer, the Ocean State's Director of Administration and former Budget Chief. And for the View from Wall Street, please welcome veteran Muni analyst Vikram Rai. Thanks to you all for joining us. We really appreciate it. And now, Shelby, to kick things off, only a few months ago, we were talking about how flush state budgets looked. What's the outlook now?
Thanks, Bill. First, it's really such a pleasure to join Penn IUR and the Volcker Alliance, and I appreciate everybody who's tuned in today to hear this very important discussion about the state and local budget environment. I also want to introduce the National Association of State Budget Officers, or NASBO, for everyone who is maybe not familiar with our organization. We're an independent, nonpartisan, professional membership organization representing state budget directors and their staff across all states, territories, and Washington, D.C. Our members are the top budget and finance advisors to the nation's governors and have the tough job of balancing budgets in good and bad economic times and when changes at the federal level impact state spending. I'm really excited that you'll have the opportunity to hear directly from one of those members, Jonathan Womer of Rhode Island, on this webinar. So to answer your question, Bill, state budget conditions overall are tightening. We hear a lot from our members right now about how it's a return to normal after the past few years. Normal meaning there are limited new funds and states are making hard decisions about which priorities receive funding. We also hear about the difficulty of managing expectations on all fronts. That's from elected officials, state agencies, the public, and other stakeholders, as many have not experienced a tighter budget environment and may have gotten used to the historic annual revenue increases and the surpluses that states have experienced in recent years. That tightening budget environment it's namely due to a number of things, actually. So one is that general fund expenditure growth is outpacing revenue growth in a number of states. And medical inflation is a large driver of that. That impacts both employee health costs and Medicaid. For reference, Just to make sure everyone is aware, as this is such a big topic, Medicaid makes up about 19% of state general fund spending. It's the second largest individual category of general fund spending behind K-12 education. It also makes up a third of total state expenditures. So when we include federal funds, other state funds, it's a third of the state's budget. Other budget pressures that states are grappling with right now include education, including school choice, housing affordability, including property tax relief, and disaster costs. On the revenue side, we have a slowing economy, as well as the impact of tax reductions that have slowed revenue growth. We've also seen states more recently revise their revenue projections for the coming fiscal year downward. Many are citing federal uncertainty as a driver of those lowered expectations for general fund revenue. That certainly also extends to the spending side and whether federal program dollars will be available in the budget as well. So of course, the big question I think on everyone's mind is whether states would be able to absorb those large cost shifts that we're seeing proposed at the federal level. And I'll say that the short answer is no. And I'll talk about a few specifically, but I also think it's really important that everyone remembers and understands that these proposed cost shifts are cumulative, and they are also in addition to current escalation in state costs and other cuts that have been made to federal funding. It's also important, like I think as I talk about this, to note that at NASBO, we're looking at the aggregate dollars in the proposals. We're not looking at how specific proposals would impact individual states, but those aggregate dollar amounts really tell the story of the inability of states to absorb, cost shifts on this scale. For instance, KFF estimated that the House Energy and Commerce proposals would shift $88 billion per year to states. And that, I know, can be really hard to gauge. Like, what is the impact of $88 billion to states? So for context, in fiscal year 2024, states spent $66.5 billion on corrections expenditures. That represents 5.6% of general fund expenditures. So that Medicaid shift is more than states spend on corrections. Yesterday, CBO released a letter which estimated that states would absorb about 50% of the total Medicaid cost shift. And I have to say that from my discussions with states and really from just looking at the simple math, that seems like an optimistic estimate, even without taking into account other cost shifts and the cuts that are impacting states. We've also seen proposals instituting a state cost share for SNAP benefits. The proposals have varied, but an early one would have phased in a 50% state match. And if we look at fiscal year 2024 SNAP expenditures, a 50% shift would be equivalent to 3.9% of that year's state general fund revenue. So if you add that shift to the proposed Medicaid cost shifts, that would actually total more than states spend on higher education from their general funds. So while the magnitude of dollars can be really hard to get our minds around, I think everyone can see how states really can't absorb these kind of cost shifts, particularly when they're taken together. I do want to end on a more positive note, which is that while state budget conditions are tightening and much of the focus is on states' inability to absorb proposed federal cuts, states' underlying fiscal positions are generally quite strong. They're always looking ahead to that next downturn, and they've spent the past few years paying down debt, making progress on pension liabilities, and shoring up savings. So I'll just say the most often cited indicator of recession readiness is states' rainy day fund levels. We've seen those increase from 7.9% of state general fund expenditures in fiscal year 2019 to an estimated 14.4% in the current fiscal year. So while these one-time funds are not a solution to ongoing fund shifts from the federal government, states are well positioned for what I'd call a normal economic downturn. And I'll pass it back to you, Bill and Susan. Thank you so much.
Well, thank you so much, Shelby, for that view from the state level. Caution of we do have rainy day funds, but that's not for ongoing increased responsibility on the state level. Now we turn to the county level, and we have with us from the National Association of Counties, Taryn Zaruda, who is the chief economist and who's been watching these issues very carefully. Taryn?
Well, wonderful. Good morning, everyone, and thank you so much to the Volcker Alliance and for having me today to talk a bit about the county perspective in this fiscal state and some of the shifts that we are seeing at the local level. So for a bit of background and context, the National Association of Counties, we also are a nonpartisan organization. We represent the 3,069 county governments across the United States. As you can imagine, those 3,069 counties are very diverse in composition. They're diverse in geography, in county size, population, in GDP growth. I mean, we have, if you look across our counties, we have representation from many different perspectives and also different levels of growth and decline across the country. So as some of these federal shifts occur, number one, I think we can expect to see varied impacts and effects at the local level as well. I'll start first by saying that county governments, we invest quite a bit into communities. We invest over $700 billion a year of the revenues that we bring in into our communities. And those revenues come from tax collections, they come from intergovernmental transfers, from fines and from fees within the county government. So they're a diverse way that we bring in those revenues, but ultimately, almost every dollar that is brought in, we are dollar in, dollar out. We typically balance our budgets, and we typically put a smaller share into reserves, and I'll talk about that here in a minute. So those services at the local level are everything you rely on from a day-to-day basis. They are the services fixing your potholes in the roads, to emergency services, emergency response, emergency care, justice and public safety, health and human services across the board, behavioral health. Counties, we own and operate about 900 public hospitals, which is a big part of this conversation as well, as local healthcare, both on the emergency care side and the sustained care side is a really important piece to our community health. We own and operate 45% of roads and 38% of bridges. So there are about 600,000 bridges on the National Bridge Inventory, and in counties, we own and operate quite a large share of those. So all of these stats are important in thinking about how, as we move forward, any cost shifts or this shift in our fiscal federalism, so who is responsible for funding services, for delivering those services, it all comes into play into this conversation. The second point that I will make is that most of our expenditures, most of what you see on a day-to-day basis is some sort of fiscal or funding partnership. Most elements are jointly financed or funded through partnerships in different composition of those funding. So for example, Medicaid. Medicaid is jointly financed. There are 74 million individuals that utilize Medicaid for healthcare coverage. About 40% of those are children. It's a partnership between the federal, state, and local government. So states generally will manage or administer Medicaid, but in some states, counties play a larger role. In 26 states, counties contribute to the non-federal share of Medicaid, and in 18 states, counties are mandated to contribute to Medicaid. So much of what you're seeing on the delivery side of our services, it is some sort of partnership financially as well as administratively. This goes for infrastructure projects as well. So roads, bridges, hospitals, schools, things that are typically built locally or driven locally, the financial structure is very much a partnership. So there are often grants or federal legislation that helps support some of this infrastructure. Then also, which I know we'll talk about here in detail, but the municipal bonds is it's a mechanism to build infrastructure in your localities. So it's a really important piece of that overall structure, and we'll get more into detail there. Counties raise revenues, as I noted, through many different mechanisms. So tax revenues, this includes property tax, sales tax, in some cases income tax. Counties are a property tax-based government, so most of the revenues are through property taxes, but it varies state by state. In states like Missouri, Nevada, Utah, Washington, Georgia, Illinois, Colorado, sales tax is a very large share of those revenues that are coming in at the local level. So as we talk about potential impacts to the overall economy, we often see, sales tax would be one of those number one revenue areas that could be hit in the event of a recession or reduced consumer spending. So it's something that's certainly important to consider in this overall fiscal condition. Rainy day funds and reserves. So one response that we are seeing at this local level is an initial look at reserves and standing up mechanisms to sustain any sort of fiscal condition that might arise. So, for example, we're seeing counties establish these special funds in their budget where they're moving over reserves to account for the next couple years where things might change, and really a focus at the local level on establishing stability. That is a top priority that I've seen across local governments, is how to establish that stability given what might change in the economy or in this fiscal structure. So I will stop there, and happy to continue the discussion or answer any questions as we move forward.
Hey, Susan and Taryn, just one quick question. I know we're not in the Q&A session yet. Put your economist hat on. What kind of probability are you putting on recession this year, next year, and has that changed?
Yeah, I think just looking at from our perspective, when we look at tax revenues that are coming in, I think we are expecting this spring to still remain and show flat or stronger revenues on the tax side. We are starting to see signs of sales tax and some of those early indicators of change reflected in those local sales tax collections. So no certainty here or definitive projection, but I think there are elements that we see in the local government. And as I noted, these establishment of funds, or we're seeing county boards voting on increasing the allowance percentage-wise of their rainy day or reserve funds. So you're starting to see the beginnings of preparation.
Well, thank you very much, Sharon. Preparation for what comes ahead, and for a Washington view of what's coming ahead, we turn to Emily Brock, who is the federal liaison of the Government Finance Officer Association. Emily?
Thank you so much. It's a pleasure to join so many bright market participants and researchers. What I like to call you is all muni advocates at heart in our space, and hopefully I'll convince you here in the next couple of minutes. So I've been doing this for 10 years now. That's Beltway math means 5 budgets, 4 debt ceiling government shutdowns, 3 comprehensive tax reform proposals. My whole job has been to defend the municipal bond tax exemption. And I do it together with 43 issuer organizations that constitute what's called the Public Finance Network. And that is the governors, the mayors, the treasurers, the counties, and the cities. But also there are professional associations on the Hill who are in water, power, gas, airports, colleges, and we all meet under the common goal of preserving tax exemption. In fact, all of those organizations have preservation of the tax exemption for municipal bonds as their top priority. We all know that the tax exemption provides capital for infrastructure. State and local governments themselves bear 75% of the cost of infrastructure in this country. And we do that by design. We like to make capital decisions locally. But we need to have the market to underpin those streets, clean water, schools, affordable housing, and so much more. And we do it to the tune of about $4 trillion. You heard me right? The municipal market is at about $4 trillion. And it takes the willpower of Congress to continue to maintain the tax exemption. It costs Congress money to provide the municipal bond. The general scoring that Congress assigns to providing the tax exemption is the cost of allowing investors to claim income that's tax exempt. And the score that they give it is about $300 billion over the course of 10 years, which incidentally scores us as one of the top 10 tax expenditures of the federal government. We are a piggy bank that they continue to look at and again, continue to see as a pay for. Because of that, we have to remain vigilant. Whenever Congress needs to pay for something, they almost always look at the muni. And I'm going to give you a case in point, 2017 and the Tax Cuts and Jobs Act, which incidentally, the sunsetting provisions must be addressed this year to preserve continuity, things like the child tax credit and individual rates. In 2017, the municipal bond came under review. Municipal bonds used by 501c3s, referred to as private activity bonds, were proposed to be eliminated. And we ultimately lost the ability to one-time advance refund bonds for cost savings. The loss of advance refunding has cost us billions in savings. All of these things are not good, but it could have been worse. And looking at 2025, there are lots of things that are similar to 2017. It's all one party in the Beltway. They have to do reconciliation, tight margins on the vote. They probably have 24 months. Then we know they have similar objectives, and other things will be similar. There'll be few decision makers in the room, and it may already be written right now. We didn't have a muni advocate in the room last time, and we suffered a loss that cost us billions of dollars. There are a few things that are different than 2017. A $35 trillion national debt figure, to say at the very least, and some complicating campaign promises like rescinding SALT. So now we're staring down competing proposals for tax reform using reconciliation. Lots of ideas how much it will cost. Who knows? Math is not mathing right now when we're trying to figure out how much this tax reform will cost. But importantly, how are we going to pay for it? There were some budget hawks that put out 2 worksheets with the tax-exempt bond proposed for elimination. That's infrastructure like libraries, housing, universities, targeted for elimination. As a top 10 tax expenditure and so many things the same, it'd be reckless of us to presume we're safe unless we get ahead of the game. So for all of us who are advocates at heart, I strongly encourage you to go to builtbybonds.com. It has a huge resource center of resource materials, but also right in the center of it, there's a map where issuers and market participants can put your projects. There is nothing like telling a member of Congress, you send your kid to that middle school, you drive down that road, you depend on that irrigation district. Stories are critical. And if you can't get to the Hill, at least we have that map and we can use that map to tell those stories. But second, we've got to get our numbers straight. So Congress says it takes $300 billion to maintain the tax exemption. So we looked back and we saw the spreads. What are issuers saving when they use the tax exemption? They issue tax exempt versus taxable. The spread in the recent past has been roughly 200 basis points. That's 2% savings. Texas issued $66 billion in 2024, about $1 billion of investments in affordable housing. You layer those 200 basis points on top of that, we're talking about real numbers. In fact, we layered that 200 basis points on our $4 trillion market. And what we found out was that equates to about $824 billion in savings over 10 years. So let me say it plainly, it's a really good ROI. In the same period, what costs the feds $300 billion to provide, we save $800 billion. Or flipping it on its head, in order to maintain 75% of our nation's infrastructure, if something happens to the municipal bond, they're voting for an $800 billion increase on taxes and fees to households across the United States. For us as investors of projects in our communities, if you lose that 200 basis point savings, your community is going to have to make the hard decision of what 20% of the roadway or community center you can't pay for, what elementary schools or park projects will have to be deferred. Now, so far, we've heard a lot of alternatives to the municipal bond. We've kind of heard it all. National infrastructure banks, P3s, opportunity zones. For GFOA, when it's discussed as a tool in the toolkit, I get it. We have absolutely no opposition to it. But if you're trying to supplement a $4 trillion market, those ideas don't get close to our needs. So GFOA and the Public Finance Network, we just don't want to be caught flat-footed like we were in 2017. We've run this drill to be clear, we are on the menu. And arguably, I'll take this metaphor a uncomfortable place further. We're not a lobster dinner. We're arguably a protein shake. We appreciate all of your advocacy so far and look forward to the opportunities we will have to tell the municipal bond story in the future. Thanks, y'all.
Well, thanks, Emily, for the protein-filled discussion. And, you know, the muni tax exemption is a great example of fiscal federalism. This is a way for the federal government to invest in local infrastructure, schools, roads, you name it, giving control to people giving control to people at the ground level, but helping with the financing and giving an incentive really to finance it on their own. So I think we should all keep that in mind. And with that, this is a reminder, as if you didn't know it, you're tuned into Special Briefing from Penn IUR and the Volcker Alliance. Thanks again to our friends at the Travelers Institute, the Volcker Alliance, and members of the Penn IUR Advisory Board for your generous support. And don't forget that you can follow archived editions of today's episode and all of our other special briefings from the past, what is it, Susan, 4 years now?
That's where we're going, right?
4 years of great discussions. They're on our websites and on the Special Briefing podcast on every platform you can imagine. And now let's turn to the muni market. Well, actually, now let's turn to my bad in the script here. Let's turn to Jonathan Womer. I apologize. To get the view from the State House in Rhode Island. Rhode Island may be the smallest state in the nation, but it's also one of the leaders in suing the federal government over multiple spending cuts, hold downs, what have you. You've had some budget gaps to close. Jonathan, tell me what's going on under the dome.
Thanks, Bill. And, thank you, Bill and Susan, for putting this together. This is a really important topic right now. And I think I'd really like to build on the conversation that Shelby started from NASBO, because there's a lot of work that happens at the state level. So, I mean, first off, I think it's important to set a little bit of context. And, you see some things in the news, but it's sometimes hard to put it in an operational perspective for what states are going through. So the federal government is really, set up fairly decentralized. And, most of the action happens at the agencies putting together programs. And, for the most part, the states operate a good chunk of those programs that the feds finance. And, despite states being laboratories of democracy, mostly they've set up their organizational structure to mirror the federal government. And so really the relationships on the programmatic level, at the funding level, are really from program to program, from the federal government down to the individual states. And, some of those programs are awfully complicated. As things change over time, there's a lot of direct conversations between the state programmatic people, the federal programmatic people. Audits happen between, funding contracts change. And often, those aircraft carriers relationships really take, a really long period of time when fundamental shifts happen. So that's typically, right, in the past, what has been going on. The real difficulty on an operational side for states right now is the degree of uncertainty coming out of Washington. So, just on the most basic level, we don't have people to talk to very often. You call people, they've been laid off. You try their cell phone, we're not allowed to talk to you, right? I mean, these are very strange places to be in, and it's left states without a lot of information. And certainly there's things in the news, but as the administration proposes new executive orders and particular cuts, and then in courts turn those around in a different way, you're left with a lot of volatility from an operational perspective, trying to figure out how to plan and strategize going forward. We're left really reading tea leaves on a regular basis. There's some hope that this will kind of come together more with the beginning of the federal fiscal year, if the federal government can kind of put together a budget strategy that's more comprehensive. But, between rescission and, the conflicts in the Senate and the House at the federal level, there's really not a lot of guarantee for that right now. So we're left with a really, really significant amount of uncertainty. Now, the states have pretty good muscle memory about how to deal with cuts and drops in revenue and changes to funding, right? Almost all the states have balanced budget requirements, and just for a normal year, right? With healthcare costs, we're generally very adept at having to cut because healthcare costs just, over the last 20 years have gone up higher than usually revenue growth. And that means that we have a lot of muscle memory of trying to figure out how to, take out hundreds of millions of dollars of a budget and reorganize. It's just built into our infrastructure. That's obviously not really built into the infrastructure of the federal government. And it certainly hasn't been, it looks like, for a while now. But when those cuts happen at the state level, typically, right, they're usually around revenue issues. Or if there are programmatic issues, it's just one or two. So right now we're facing the possibility of a lot of uncertainty at the programmatic level, a lot of individual changes, and changes associated with how much revenue we're getting. That's a lot more complicated. And my concern is, as we go through our own budget processes, as the federal government sort of finally figures out exactly what it wants to do, that we're going to have a lot of vulnerable populations put in the crosshairs as a result. I think also fundamentally, as much as we are trying to do strategic plans and working groups and what if analysis for various programs, there's only so much preparation we can really do right now with this degree of uncertainty. I really expect as the sort of fall gets here and things hopefully come into more focus, we're probably going to see a lot of special legislative sessions in ways that we haven't in the past. We're probably going to have a lot more difficulty in figuring out what the budget changes need to happen at the state level to keep really the programs working in our constituencies flush with programmatic needs as necessary going forward. Very, very difficult. Now, on top of that, there's possibilities of recessions. And, as was discussed a little bit earlier, most of us at the state level are going through revenue projections right now. April being the big month that it is. Typically, states have a very large revenue recalculation right after the April timeframe that helps also then settle the end of the fiscal year, and most states have that in the June-July timeframe. And so we're going to be going through probably some decent amount of reductions just based on the uncertainty that's hitting the marketplace. But then in a few months, the projections that we're looking at are certainly hundreds of millions of dollars of possible programmatic changes. And that's why I think additional legislative sessions are probably in the works. Bill, turn it back to you.
Yeah. Thank you, Jonathan. It's a little sobering. So I'm sort of taken aback. You multiply Rhode Island times 50, all of a sudden you're talking about real money. So let's now turn to Vikram Rai and see how the market is taking, on the one hand, the threat to the immunity tax exemption, on the other hand, the threat to state revenues, the ability of states to balance their budgets properly, and also some of the sectors that may get whacked. It's a reminder that back in the 80s, federal funds, this is according to the Pew, federal funds made up about in the 20 to mid 20% of state general funds on average. Their latest figure is more like 35% plus or minus. So, we may be getting back to a situation of 40 years ago, and learning how to cope with that. So Vikram, give us your impressions.
Hello, Bill, and hello, everybody. It's my pleasure to be here again. So I am unaffiliated for the next 37 days, and which gives me a lot of flexibility to actually present my honest views. So unfortunately, I'm pessimistic about the situation in the muni market in general, markets in general. So let me unload all my worries on you. So let's start with the macro environment. I'm worried about rates. I think all these machinations and the haphazard policy implementation has damaged the market. So treasuries used to be the safe haven, and that unquestionably is being challenged now. Now, I was speaking at a Bloomberg panel yesterday, and everybody was referring to municipals as a safe haven asset. I don't know if that's true anymore. I realized that until some time ago, San Francisco Airport was rated AAA, which frankly I didn't agree with, because when the U.S. Treasury debt is rated AA+, then how can an airport, how can a city be rated AAA? So on that note, Emily talked about the threat to tax exemption very eloquently. One or two things that worry me about the calculation that has been put forward. So they talk about tax exemption costing the federal government about $300 billion, and they count that as revenue generation over the next 10 years. Now, whether they are doing it retroactively, meaning that they go after tax exemption retroactively, as in they make all the existing bonds taxable, or they go up after it prospectively, is a bit of a question. Now, in theory, you can reach that number prospectively, meaning that all new issuance will be taxed. And given that currently taxable issuance is about 10% of the market, the expectation is, I think what they're trying to do is they believe that the new bonds, the new issuance will come taxable, so as it rolls off, and that's how it will generate revenue. Now, that practically makes no sense, because why do retail investors buy munis? They buy munis for one reason and one reason only, and it's not safe haven. It's to save on taxes. So if munis become taxable, then that will destroy the buyer base, and so there'll be a seismic shift in the buyer base. The retail investors will have to be replaced by the institutional investors, and that will take time. So will the institutional investor buy the $25 million taxable deal? No, they'll not, right? Because they're used to more liquid markets. So the notion that there'll be a seamless shift from tax-exempt issuance to taxable issuance, especially for the smaller cities, is just ludicrous. Now, on that note, yes, if there is a prospective challenge to tax exemption and the existing bonds are grandfathered, yes, the currently outstanding muni bonds will shoot up in value, no doubt about that. Now, also on the topic of tax exemption and what are the sectors that could be impacted. So I think 2 days ago, Mr. Bill Ackman was on CNBC, and he was talking about how he believed that Harvard should lose its tax exempt status, but he didn't think that it could be done. And I think the president of Harvard has come out and said that it will be highly illegal for the tax exempt status to be taken away. Now, I disagree on all points. I think universities should be allowed to keep the tax exempt status, but can Congress take away that tax exempt status? Absolutely, they can. And Emily mentioned this too, that in the past there have been attacks on the private activity bonds. So private activity bonds mainly consist of higher ed. Who are the issuers in this space? You have higher eds, you have hospitals, you have airports, and you have housing. So education is definitely in the crosshairs. And so I think higher educational institutions need to worry about the possibility that they might lose their tax exempt status. And there is also the endowment tax, which affects only the higher strata of universities, the more wealthy ones. Nonetheless, given that there's so much market volatility, I think there are some doubts, there are some questions about whether the carrying value of their endowments are true. So I think there will be some credit impact there on universities. Then you have hospitals. I have been a muni strategist for 10 years. I have never started a year saying that I feel optimistic about the healthcare sector. And now this is especially true with all the attacks on Medicare and Medicaid to a larger extent, and see on Medicaid too. See, this is how states will impact it the most. And I think blue states, just some quick thoughts on credit too. So I worry about blue state credit. And the obvious question is how. And so think about just Medicaid. If the Medicaid, that's the one of the largest expenses that all states have. Now, blue states, right? What could they do if they experience cuts to the federal funds for Medicaid? Well, they can actually cut benefits or increase taxes. Now, cutting benefits, it's not really in the DNA for at least for the democratic states. It's not in anybody's DNA, I want to believe. Increasing taxes, given that the blue states already have high taxes, that is a worry. Do they have the ability to do that? I don't believe so. And out-migration is a genuine problem in the high-rated states like California and New York. Now, one of my panelists mentioned pensions. That could they actually defer pension payments? Yes, they absolutely can. We know Illinois has done that in the past. Cities have done that in the past, but that will lead to downgrades. And then there is this belief, right? That don't fight the Fed. I think that should also apply to the federal government. Don't fight the federal government because the federal government is very powerful. So I am very uneasy when I hear about cities and states suing the president or the administration. I realize that that they're within their rights to do that. But I look forward to news about a cooperative environment. Just let's take for instance MTA. Now MTA, I have great respect for Governor Hochul. I think I have great respect for MTA management, right? I think they have shepherded MTA through some very, very dire times. But congestion pricing, for instance, should have gone into effect last June, right? July latest. Governor Hochul delayed it with an eye to elections, and it seemed like a strategic move at that point. But now I think that strategy has not borne out, and given all the ill will between the mayor, the governor, the president, if congestion pricing is rolled back and President Trump is within his rights to do that, I mean, at least he has the power to do that, that will impact MTA very adversely. Now, as a commuter, it'll make me happy because I think congestion pricing hits us in the commuters from New Jersey and New York and Connecticut very hard, but it is very bad for MTA credit. So these are the issues that worry me, and I could go on. I mean, I could talk about this for hours, and I realize all of us could. But I'll just close on the note that what another challenge which I think is facing the muni market is a liquidity crisis. So broker dealers, I mean, as you know, that Citigroup exited the market 2 years ago, and munis, right, in this volatile environment, in this environment when balance sheet costs are high for broker dealers, when rates I think will remain high, munis are not an optimal asset class for the balance sheet. So I worry, and also given that they have a very adverse convexity profile, broker dealers are not able to hedge them properly. And I know this firsthand. So whether it's a sharp sell-off or whether it's a sharp rally, munis always underperform. So that leads to tremendous pain and volatility. And I worry that that we could see more broker dealer exits from the muni market, which would hamper liquidity very adversely, and especially in an environment where we could be seeing shifts in the buyer base. So like I said, I could go on. I mean, but I do worry about the market. So I think the next year, or at least until we see the conclusion and the implementation of the extension of TCJA, I would be on my tenterhooks. Back to you, Bill.
Well, let me step in here. Thank you so much, Vikram. We are now moving on to the questions and answers, but I have one question for you, which others may wish to weigh in as well. You have given us a very
and Susan, let me interrupt for 1 second. Just to panelists, please turn your cameras and mics back on so everybody can see you. And one small interjection: we had some questions about the outlook for mass transit funding. We probably won't get to that today, but in our March special briefing, we did a really deep dive into that subject. Not a whole heck of a lot has changed since then. I encourage you to go back to the podcast or the archive version on our sites, and you'll get your answers there. Susan.
Yes, thank you very much, Bill. So Vikram, and then please follow up. But you started this point. You said liquidity issues, and you also mentioned issues of tax exemption, obviously, but then also taking away the muni tax exemption. But then you brought a third challenge to the table, which is removal of tax exempt status from state and local institutions that have been providing local programmatic assistance. And in addition to that, withdrawal of federal support, programmatic support. So that's number 4. And I'm counting here. I believe we're now on number 5, which is an increase in uncertainty. So we have 5 challenges to the state and local ability to serve populations. Of these 5, Vikram, what would you say is the most severe challenge?
So it's a difficult question, Susan.
I don't like to ask easy questions. I don't know how
I don't know if I can rank them that eloquently in my mind, but see, I'm worried about the macroeconomic environment, right? So I think higher rates has a direct impact on state and local governments because their financing costs go up. And so I think that is a primary challenge that they face, and then they have to face with them. So high rates also mean that the cost of funding goes up, but they need to access the market because state and local governments can sit out on the sidelines for only so long. So they will have to come to the market in an uncertain environment when the buyers won't be willing to buy, because as you know, munis are your typical spread products. So when there's any uncertainty, buyers will step back on the sidelines. And then given this policy uncertainty that, okay, I could buy tax exempts today, but will they remain tax exempt? And the wealth effect, the wealth destruction that could happen if the tax exempt status is taken away in any shape or form is tremendous. So I think the liquidity challenge is a secondary worry. I worry about the macroeconomic challenges facing the muni market, and also the shifting buyer base or worries that retail. And it's an incredibly concentrated market. So in theory, we have a lot of buyers in the muni space. We have banks, we have insurance companies, we have mutual funds, and then we have the retail buyer. But honestly, 73% of our market is retail. So if retail gets spooked, they will step back from the market. And if they step back from the market, who will buy the debt that state and local governments need to issue? Because now more than ever, they're reliant on financing their needs.
That's a very sobering response. Thank you, Vikram. I want to go to you, Jonathan. You're in the crosshairs of this. What right now do you see as your most serious challenge? And then perhaps what are you concerned about more in the longer run?
Yeah, I mean, right now, I think the thing I'm most worried about is reprioritizing programs that are going to be shifting around from the federal government. That's going to be, I think, the greatest challenge, because you've got state legislators, you've got lobbyists, you got advocates, you got the programmatic people trying to get all that alignment through a legislative process when so much is moving around, I think is going to be really, really difficult. And then in the long run, gosh, if we're really talking about, some of the budget numbers we're talking about, then we have to fundamentally rethink our relationship with local government on a financial basis. We have to rethink our tax base on a fundamental basis. You have to kind of go back to the drawing board if this is going to be the new federal-state relationship. We're going to have to readjust all of our relationships from a financial perspective just to remain on the right path.
Jonathan, can you give us more specificity on? I'm sorry, just to quickly follow up.
Yeah.
You're being general here. Readjust. Let's be more specific.
Yeah, we give a lot of aid to municipal governments, right? And how much money that is, and you're gonna have to think heavily about that. You're gonna have to think heavily about, how we structure provider hospital reimbursement rates. We're gonna have to think a lot about what we can afford from an eligibility standpoint in major service programs, and then certainly on the tax bases everywhere. We're just there are big numbers in various spots, and we're going to have to really think about all of them in a world where the federal government has really rethought their relationship with states. I mean, that's just the way everything is going to end up trickling down.
Let me ask a follow-up. It's a couple of related follow-ups. Number one, you're absolutely right. It's a traditional tactic in hard times for states to push costs down onto the counties to push costs down onto cities, maybe school districts. We've seen it happen before. You're in the crosshairs, as Susan mentioned. Taryn, Shelby, you're also in the crosshairs. So how is this process going to work? And especially in regards to Medicaid, states are the conduit for a lot of funds. Counties run a lot of hospitals. Is there going to be an off ramp if Medicaid funding is cut, or is it just one day your reimbursement rate goes from X to X minus 5 or something? And please, it's a jump ball kind of question, so everybody jump in.
I'd be happy to jump in. Thank you for the question. I think that hits it right on the nail, right on the head. I think when we're thinking about the cost shift, it's really then going to be a question of one, how do you provide those services? So what is the cost, and who do we pass it along to? And very often that's taxpayers. It could be in the form of a special tax, sales, property, levying an additional tax or increasing taxes to cover those costs. I mean, counties are the service provider of last resort in many of these cases where other systems don't pick up the costs, like Medicaid, if there are shifts there. Counties cover indigent care and, as you mentioned, hospitals, emergency rooms, behavioral health responses. We own 91% of jails across the country, which unfortunately end up being the provider of mental behavioral health services as well. So those services or programs, if they continue, we'll need to look at those, the taxpayer, and then if not, you're looking at what those implications are for society. One point here I wanted to make too is I really think we should keep an eye on rural America. And 2,100 of the 3,069 counties, about 70% are rural. That's under 50,000 population. And historically, especially back in 2008, when we saw major shifts and decreases to local budgets, we saw the largest impacts and biggest hits to those rural communities with rural hospital closures, care just really decreasing in those rural areas. And that's also for the municipal bond market. Projects under $100 million, rural areas use that municipal bond mechanism to fund these smaller infrastructure projects. And if that ability goes away, then you're looking at not only infrastructure, you're looking at healthcare and overall societal impacts in that rural population.
And if I'm not mistaken, this is heavy MAGA country, so don't forget the political implications of cost shifts. I had one other question that's come up a whole bunch of times from our audience, which is about pensions. After the last couple of recessions, we saw pension deficits widen. States not making their required contributions. Some states like Connecticut, Rhode Island, really went. New Jersey took heroic efforts to improve their pension funding and make it more rule bound. So what happens going forward now? States lose money, counties lose money. Are we going to see the same kind of avoidance mechanisms, if you will, with pensions, pension bond issuance, shortchanging the annual contribution, which even Texas, AAA rated Texas, did for years. Again, this is a jump ball. Maybe Jonathan, if you want to start with that, because under Gino Raimondo, you did do a lot of work to shore up the pension system.
Raimondo did certainly a lot of work in that regard. And I think one of the pieces that is really important, besides just the reforms on just the way the money flowed and putting us on a good path was also just the move to more transparency about how pensions were funded in Rhode Island. And I think in particular, you know, it's one of the things I didn't mention when I talked about the long run, what we look at. And, you know, certainly each state's going to have a different flavor of that in their own situation. But I think the transparency reforms that happened in Rhode Island make it very unlikely that's a place that we would go because it's now a little bit more built into the public DNA of operating government. And in our union partners and the legislature, that it's of the major pots of money in restructuring, I wouldn't expect that to be one of them here. But you know, not every place is like that, and you know, I don't know. Maybe Shelby could talk a little bit more about that from a broader perspective.
I can see that Emily also wanted to address this. You know, I think the thing to keep in mind too is that states and localities, they are responsible and they like to meet their obligations and they work really hard to meet those obligations. It's really hard to know specifically what's going to happen going forward. And, you know, these things don't happen in a vacuum, and, you know, there's all these other budget pressures and things that are happening. So I think that's a difficult question to really pin down. You know, it's such a forward-looking question. I think so I wanted to make that point, and then also just the options states have are, you know, they're pretty limited. So all this comes down that the options are to raise taxes, implement program reductions, and make budget cuts in other areas, or a mixture of all three. And when you talk about the magnitude of what's happening, and the fact that it's ongoing, so these are things that need to be addressed ongoing. You know, budget cuts in other areas are not going to fill that hole. And so I think what we're really looking at are program reductions. These are going to result in cuts. That's what we've heard from states, that they're not going to be able to backfill. And it's also just what the basic math tells you, right? When you look at the math of it, that's the choices are pretty limited.
So here's another probably hard question looking forward. If it's going to be program cuts that make up the difference, what's the most likely area for the program cuts? Or is it too soon to tell? And this is for everyone.
Well, what I was going to say,
it's too soon to tell.
Yeah.
Like, I think it's very early. We don't know the magnitude. We don't know, and it's gonna, you know, it'll vary from state to state, both what the impact is and how they respond to that. So it'll be a mix, and it's going to be tough to meet for sure.
I mean, I think if you look at program cuts and the decisions that need to be made with program cuts versus deferring needed infrastructure investments, we know what's probably going to go first, right? So I think
that's deferring infrastructure. Is that what you're?
Maintenance, yeah, sure, yeah.
Yeah,
right. I mean,
it's definitely, you know, you defer costs and you look for program cuts where the money is.
And where is the money?
Medicaid and education.
And that's for sure. Infrastructure, unfortunately, is very easy to shortchange. At the Volcker Alliance, we're working on a big project on deferred infrastructure maintenance. It'll be out in a few months, so watch this space. And I think we're actually going to have to wrap up. I'd like to keep this conversation going forever, Susan, but it's just about to the top of the hour.
Well, until next time, Bill, and thank you to the panelists.
Yep, everybody's got their day jobs. So let's call it a day for this edition of Special Briefing. Thank you so much to Susan Wachter and to our great panelists. And special thanks to our production team, Megan Schmigdal, Shannon Mannon, Eamon Montgomery, Delphina Vildosola, Graham Dowd, and Noah Ritzberg. If I missed anybody, my apologies. And thanks as well to the Travelers Institute, the Volcker Alliance, and members of the Penn IUR Advisory Board for your generous support. Special Briefing is taking a break for the summer, but we'll be back in September with more cutting-edge discussions on, and I'm sure we'll have a lot to talk about by then. So please watch our websites and your email for details. In the meantime, catch up with the best of Special Briefings on our podcast and websites, and watch for details on September's program. And so for now, I'm Bill Glasgall. on behalf of Susan Wachter and the entire special briefing team, and we'll see you again in September.